free. My mama told me, son, you could be anything, long as you spread your wings. I know one day you'll be great. Just wait, soon you'll aim up at the sky, and I'll watch it float away. But now that I am older, I'll admit that I am over all the stress and shit that comes from holding life upon your shoulders. It's a chore. I'm sick of being bored. I'm sick of always stressing I could ignore. I guess it's just my own immaturity.
An optical illusion is defined as an experience of seeming to see something that does not exist or that is other than what it appears. For example, Anthony Escher's artwork that is created to visually challenge the audience. A magician who cuts in half a box that has a person inside without actually cutting the person. A picture consisting of many different colored and sized ovals making up larger circles. When viewed, though motionless, the circles appear to rotate. A person walking on the ground can appear to be walking up a wall when the picture is rotated. And a popular picture of a goblet that, when vision is readjusted, appears to be two faces looking at each other. These visual illusions occur due to properties of the visual areas of the brain as they receive and process information. In other words, your perception of an illusion has more to do with how your brain works and less to do with the optics of your eye.
Hello, so I'm going to talk a little bit about how optical illusions can help in treating people with mental disorders of various types. A lot of time they're used with schizophrenia and other mental disorders where people are imagining and seeing things that might not actually be there. Other illusions like that. Inkblot testing is something that a lot of psychologists use to kind of get at the subconscious level of their patients. For example, if they're given a picture, as the one that will be shown, they'll be like, is that a skull? Is that a dog? And whatever they start talking about first and whatever comes to mind and whatever they elaborate on and however they talk about it reveals how they feel about a certain topic. For example, this inkblot has kind of an underlying feel of maybe a skull and then there are obviously like the two dogs. So if the patient looks at the skull and then talks about a time that someone died or something like that, then it might show that they have a lot of underlying resentment towards the death and that sort of thing. Inkblot testing was first brought about in the early 1900s, and it kind of had its peak in like the 50s and 60s, and now it's kind of going back downhill again with with how popular it is because we have a lot better ways to test that now. But I think the key concept with inkblot testing is that it's really up to you to decide what you are going to take from it, and no one tells you, talk about this dog that you see, or the skull. It's just talk about it. You don't have to talk about anything specific.
Optical illusions. They're pretty cool things, but you might be thinking, how do they actually work? And there is a scientific explanation to it. Now, you might think that optical illusions just trick your mind, but that's not true. Your mind quickly identifies things, like mental cues, when looking at an object. Now, in this picture, there is going to be a face in which you should see. Now, when you look at them, you're going to quickly identify certain cues, like a nose, a mouth, and the characteristics of a face. But if you look closely, there's actually two faces. Now, you might not see both of them. It's because your mind picked up on certain cues first. If you look closely, there is two. Your mind quickly identifies certain features within less than 1/10 of a second, and this quick reaction by your mind is actually what makes you see certain things. So the optical illusion isn't necessarily tricking you, but it's what your mind perceives to be right when it sees the picture.